What is neurofibromatosis? Neurofibromatosis is a genetic disorder of the nervous system. Tumors form on your nerve tissues. Mainly, neurofibromatosis disorders affect the growth and development of nerve cell tissue. Neurofibromatosis is a genetic disorder of the nervous system. It causes tumors on your nerve tissues. They're called neurofibromas. Your symptoms may affect your skin, brain, spinal cord, and nerves. Spots of dark pigment on your skin can be one sign of the condition. You might have neurofibromatosis because of a gene you inherited, but some cases happen without any family history. Types of neurofibromatosis. There are 3 types of neurofibromatosis. Neurofibromatosis type 1, NF1, has many other names, including Recklinghausen disease, von Recklinghausen disease, von Recklinghausen's phacomatosis, von Recklinghausen's neurofibromatosis, neurofibroma, neurofibromatosis pheochromocytoma duodenal carcinoid syndrome, peripheral neurofibromatosis. It causes multiple darker spots and neurofibromas on or under your skin. It can cause enlarged or deformed bones and curvature of the spine. Occasionally, tumors may develop in the brain, on cranial nerves, or on the spinal cord. About 50% to 75% of people with NF1 also have learning disabilities. Neurofibromatosis type 2. Experts have begun calling this type NF2-related schwannomatosis. It's also called bilateral acoustic neurofibromatosis, vestibular schwannoma neurofibromatosis, or central neurofibromatosis. It's much less common than NF1 and causes multiple tumors on the cranial and spinal nerves. Tumors that affect both of the auditory nerves and hearing loss beginning in the teens or early 20s are generally the first symptoms of NF2. The slow-growing tumors also can cause cataracts and numbness or weakness in your limbs. Schwannomatosis. This is the rarest form of the condition. It's divided into several subtypes depending on the genetic changes that cause it. You might have no symptoms at all, or you might have tumors on one part of your body and chronic pain. Your fingers and toes might tingle and feel numb. How common is it? A review of several studies on NF1 concluded it affects roughly 1 in every 3,000 people. NF2 affects 1 in every 33,000 people. Schwannomatosis is thought to affect about 1 in every 40,000 people, though research on the subject is limited and experts are not confident about those estimates. Neurofibromatosis symptoms. Your symptoms will vary according to what type of neurofibromatosis you have. Neurofibromatosis 1 symptoms. When you have neurofibromatosis, you may get areas of darker pigmentation. Spots like this one usually are benign, but they can become malignant. These symptoms appear in people with NF1. Several darker spots, sometimes called café au lait spots, on skin. Multiple freckles in the armpit or groin area. Tiny growths in the iris of the eye. These are called Lisch nodules and usually do not affect eyesight. Neurofibromas that occur on or under the skin, sometimes even deep within the body. These are benign tumors, but in rare cases, they can turn malignant or cancerous. Bone deformities, including a twisted spine or bowed legs. Tumors along the optic nerve, which may cause eyesight problems. Nerve-related pain. High blood pressure. Osteoporosis. Learning disabilities. Large head size. Short stature. Behavioral issues such as attention deficit hyperactivity disorder. Neurofibromatosis 2 symptoms. People with NF2 often have these symptoms. A type of tumor called acoustic neuroma. Loss of hearing. Weakness of the muscles of the face. Dizziness. Poor balance. Ringing in ears. Incoordinated walking. Cataracts that develop at an unusually early age. Headaches. Schwannomatosis symptoms. People with schwannomatosis may have the following symptoms. Pain from the enlarging tumors. Numbness and tingling of the fingers or toes. Weakness in the fingers and toes. Chronic pain. Loss of muscle. Doctors must first rule out NF2 before they can diagnose schwannomatosis. Neurofibromatosis causes. Crow's sign is freckling in the armpit of those with neurofibromatosis type 1, which is also called von Recklinghausen's disease. Neurofibromatosis often is inherited, but about 50% of people diagnosed with the disorder have no family history of the condition. That's because it can result from a sudden mutation in your genes. Once this change takes place, you can pass the mutant gene on to future generations. NF1 gene. The NF1 gene on chromosome 17 makes a protein called neurofibromin that controls your cell's growth. The mutation of this gene causes a neurofibromin loss and uncontrolled cell growth. NF2 gene. The NF2 gene on chromosome 22 makes a protein called merlin or schwannomin. It suppresses tumors. Changes to this gene cause a loss of merlin and uncontrolled cell growth. Schwannomatosis gene. Mutations of two known genes are linked to schwannomatosis, SMARCB1 and LZTR1. Both suppress tumors. Neurofibromatosis diagnosis. Neurofibromatosis is diagnosed using a number of tests, including physical examination, medical history, family history, X-rays, computerized tomography scans, magnetic resonance imaging, biopsy of neurofibromas, eye tests, tests for particular symptoms, such as hearing or balance tests, genetic testing, NF1 diagnosis. To receive a diagnosis of NF1, you must have two of the following features: 6 or more dark spots that are 1.5 centimeters or larger in people who have had puberty, or 0.5 centimeters or larger in people who haven't, 2 or more neurofibromas of any type, or 1 or more plexiform neurofibromas. Freckling in the armpit or groin. Optic glioma. 2 or more Lisch nodules. A distinctive bony lesion, dysplasia of the sphenoid bone, or dysplasia or thinning of long bone cortex. A first-degree relative with NF1. NF2 diagnosis. To be diagnosed with NF2, you must have bilateral vestibular schwannomas, also known as acoustic neuromas. These are benign tumors that develop from the balance and hearing nerves supplying the inner ear. Or family history of NF2 plus unilateral or bilateral vestibular schwannomas, or any two of the following health conditions: multiple meningiomas, glioma, any neurofibromas, schwannoma, juvenile cataracts, gradual hearing loss, ringing in the ears, balance problems, headaches. Schwannomatosis diagnosis. Schwannomatosis diagnosis is based on these criteria. If you're 30 or older, you have no evidence of vestibular tumors on an MRI scan, no known NF2 gene mutation, and 2 or more schwannomas within or between skin layers, including one confirmed by a biopsy. You have one schwannoma confirmed by biopsy and a first-degree relative who also meets the criteria. If you have a type called segmental schwannomatosis, you have tumors limited to one area of the body, such as your arm, leg, or spine. Neurofibromatosis treatment. There's no cure for neurofibromatosis. Treatments focus on controlling symptoms. There's no standard treatment for NF, and many symptoms, such as dark spots, do not need treatment. When treatment is necessary, options may include surgery to remove problem growths or tumors, chemotherapy or radiation if a tumor has turned malignant or cancerous, surgery for bone problems like scoliosis, therapy, cataract removal surgery, aggressive treatment of pain linked to the condition, stereotactic radiosurgery, auditory brainstem and cochlear implants. Genetic studies. You can have genetic tests done to confirm your diagnosis, though they aren't necessary in many cases. You might want genetic tests to provide information for other family members who could be affected, or you might want testing before deciding to have a baby. Genetic tests for schwannomatosis aren't considered helpful. Clinical trials. You might benefit from joining a clinical trial researching neurofibromatosis. When you enroll in a clinical trial, you're helping researchers test new approaches to a condition. The National Institutes of Health has information about joining a clinical trial. The NIH also maintains a searchable database of clinical trials. Living with neurofibromatosis. Educating yourself about your condition will help you work with doctors to manage your health. That knowledge can give you a sense of control and help you focus on your specific symptoms. Specialists you might need to see include geneticists, neurologists, neuro-oncologists, radiologists, neurosurgeons. You may want to join a support group so that you can connect with others who share similar experiences. The Children's Tumor Foundation is one resource for finding support. Researchers are starting to focus on broader issues that affect people with neurofibromatosis. Depression and anxiety are common with this condition. Seeking mental health care in addition to tending to your physical symptoms can improve your quality of life. You can take specific steps to address some of your symptoms. Balance. Physical therapy, balance training, and occupational therapy can help you deal with everyday tasks despite balance issues. Hearing. If you have hearing loss, you may want to learn sign language or try hearing aids or implants. Tinnitus. There are behavioral therapy approaches to dealing with this issue. Pain. Meditation, acupuncture, and behavioral therapy can help you deal with pain. Caring for a child with neurofibromatosis. If your child has neurofibromatosis, it's important to talk to them about their condition in an age-appropriate way. Experts offer these tips. Educate yourself about the condition. Try not to let your own worries and concerns dominate. Get guidance from your child's doctor. Plan the conversation. Who will be there, what you'll say. You may want to rehearse. Your child's reaction may not be what you expect. The conversation should be ongoing. Be honest. Answer questions that you can, and look for resources for those you can't answer. Provide your child with sources of information. If they search online, they may find information that's not accurate or appropriate to their situation. Tend to your own mental health. Neurofibromatosis complications. Neurofibromatosis complications may vary from person to person. They typically stem from a growing tumor pressing against your nerve tissue or an internal organ. NF1 complications. Possible NF1 complications include neurological problems like trouble learning or thinking, anxiety or distress with changes to your appearance, skeletal problems like bowing of the legs, scoliosis, fractures that don't heal, or low bone density, vision problems due to a tumor pressing against the optic nerve, problems during times of hormonal changes, such as puberty or pregnancy, cardiovascular problems like high blood pressure, breathing problems, higher risk of some cancers, such as breast cancer, leukemia, colorectal cancer, brain tumors, and some soft tissue cancers. Benign adrenal gland tumor that could cause high blood pressure. NF2 complications. Possible NF2 complications include partial hearing loss or deafness, nerve damage in the face, benign skin tumors or schwannomas, vision problems, weakness or numbness in your extremities, benign brain or spine tumors that need to be removed with surgery. One possible schwannomatosis complication is severe pain that requires specialist medical treatment or surgery. Neurofibromatosis outlook. Your outlook depends on the type of NF you have. Often, the symptoms of NF1 are mild, and people who have it are able to lead full and productive lives. Sometimes, pain and deformity can lead to significant disability. The NF2 outlook depends on your age at the start of the disease and on the number and location of tumors. Some can be life-threatening. Takeaways. Neurofibromatosis is a disorder of the nervous system. It might affect your skin, brain, spinal cord, and nerves. It can be caused by an inherited gene. There's no cure. You may need medicine and surgery to help manage your condition. Neurofibromatosis FAQs. What's the life expectancy of people with neurofibromatosis? If you have relatively few complications, your life expectancy is about the same as someone without neurofibromatosis. Can neurofibromatosis be cured? No. There's no cure for neurofibromatosis. How does neurofibromatosis affect a person's life? Some people have very few symptoms. You might have trouble with certain aspects of daily life, depending on where tumors form in your body. It's important to have a care team to address all the aspects of your condition, including mental health impacts. At what age does neurofibromatosis show up? Signs might be present at birth. Others appear as you grow older. Dark spots on the skin can show up in the first few years of life, and groin and armpit markings may develop later in childhood. Symptoms of schwannomatosis generally appear in adults. Should neurofibromas be removed? If a tumor causes pain or weakness, your doctor may recommend surgery to remove it. Surgery also may be the best course if a tumor is growing fast or if your doctor suspects it might develop into cancer.